how I got involved with Waiting Room Solutions is I signed a contract, a consulting contract and billing contract for a physician entering private practice. He had already signed, or hadn't signed a contract, but he had already evaluated EMRs and had selected Waiting Room Solutions. We actually evolved. Dr. Mestre, who is gastroenterology for children, has been a client of mine for a number of years and had his own billing software, but was still using paper charts. After the first year of working with Waiting Room Solutions and pediatric nephrology, I realized how much the EMR would help Dr. Mestre, and we were able to convince him to try, and we went live in January of this year, and it has done very well. The third client had no software whatsoever. They were doing everything manually, so when I picked them up to do the billing, I personally signed a contract for the billing module of Waiting Room Solutions so that I could handle their billing. Far superior. That's the reason I have 3 clients on Waiting Room Solutions. I like the software. I think it's a great value. Waiting Room Solutions, and this is probably standard for the industry, but I've encountered a number of software packages that don't do things like this. You have the diagnosis codes preloaded. You have the CPT codes preloaded. You have the Medicare fee schedule preloaded. You have access to the NPI database, so that these are all search drop downs within your software, and it's just wonderful to work with that, as opposed to the old days when you had to keep every one of these things in. The ability to create and generate our own reports, I think, is tremendous, as opposed to having to go through a support team or development team to get custom reports and pay for each report. I just really like being able to create my own reports. Not only would I recommend it, I have. I recommended it to Dr. Mestre, and when it came time for me to personally purchase software in order to engage a new client, I selected Waiting Room Solutions. It's just a huge benefit with the physician's chart note passing directly over to billing. It is a tremendous benefit. Patty has been a joy to work with. I work some strange hours. I might email Patty on a Sunday evening, just so the message is out there when she gets there on Monday, and then out of nowhere I get an answer Sunday evening. She has been a joy to work with, as have Nora and Risa. I don't think we can say enough about that. It's imperative that you have a team to work with. It doesn't do any good to acquire software and then be left standing around not knowing what to do with it. You don't need to lose hours per day waiting for someone to respond. I was actually at a remote site yesterday implementing the patient portal. That was the gastroenterology group. Up until this point, they had not used it. And I think it could benefit their practice tremendously, and we did finally implement that yesterday. Minimizing telephone tag will be a tremendous benefit for this practice through the portal. Prescription refills will help. Patient education materials that you folks have already posted out there are excellent. We can upload our own as we need them. I just think it's a tremendous resource. I can't say enough about the value of the product. What you folks bring to the table is really overwhelming. I just can't say enough about it. If you are a small existing practice evaluating waiting room solutions, I recommend that you spend the extra few dollars for on-site training. The cost of the mistakes that you're going to make will be much greater than the cost of having the implementation team show up at your door and do some actual live hands-on training.